Hello. Oh, not sure if I'm live. Oh, yes, I am live. Hi there. This is Dr. Myckatyn at West County Plastic Surgeons of Washington University. Hi, this is Dr. Myckatyn at West County Plastic Surgeons of Washington University. Today, a little bit about tummy tucks, also known as abdominoplasties. And so, what I'll do today is just kind of talk to you a little bit about what that operation requires, what's involved with that operation, and then also we'll be talking to you a little bit about why somebody may want to choose that operation over some of the alternatives, such as doing liposuction or maybe some non-invasive alternatives as well. So, what is a tummy tuck? So a tummy tuck is a procedure where the board certified plastic surgeon is removing tissue, excess tissue from basically the pooch area between the belly button and just over the pubic area. So we are removing that overhanging skin and fatty tissue that's sort of along the from the lower belly button down to the pubic area. It's that kind of extra tissue that can develop most often in women after pregnancies or in folks who have lost weight, where that skin can become excessive. So part of a tummy tuck is removing that extra skin and fatty tissue. But it's not just that. It also involves the plastic surgeon sewing together the six-pack muscles. So our torso, the width or the diameter of our torso, relates to the partly how much your stomach muscles or your six-pack muscles have separated from one another. So by sewing those muscles together, we're able to narrow the diameter of your waist. And that is partially how we can get better contour. That separation between the six-pack or stomach muscles is called your diastasis recti. And so we're bringing those muscles together to narrow up the waist. Another part of a tummy tuck is what you do with the belly button, because if we're removing all that skin and fat from the belly button to just over the pubic area, well, what happens to the belly button? Does it get pulled down right above the pubic area? And of course, that could look not like something that you would want. And so, rather than that, what we do is we actually make an incision around the belly button, and then it stays where it is. And what happens is the abdominal skin and fat then gets pulled down over top of it like an apron. And then we pop the belly button back through that apron. So that way the belly button remains in the same location. You want your belly button to sit essentially at the same level as the what's called your iliac crest or your bones of your pelvis, sort of in the middle part of the abdomen. Sometimes, if we're not removing quite as much skin, we'll do something different, which is called floating the belly button. And in that case, there's no scar around the belly button, but it does mean we can't remove quite as much skin without moving the belly button too much. And what somebody doesn't want is the belly button too low, because then that can also look kind of unusual. So there's a couple options for the belly button. So why would somebody pick to have a tummy tuck rather than liposuction? So the big reasons really relate to excess amount of skin, as well as the fact that the muscles have been separated. So if somebody chooses to have liposuction, the advantage of that is you don't have nearly the same scar. So with a tummy tuck, depending on the extent of the tummy tuck, whether it's a mini tummy tuck where the scar is just over the pubic area, a standard tummy tuck where the scar kind of goes from the hip pointer to the hip pointer, or beyond that, if we're trying to remove more skin. With liposuction, the scars are small, little, just usually 3 or 4 millimeter little incisions, and then we suck out fat through those. So that's an advantage of liposuction. But liposuction does not allow us to remove skin. You can sometimes get a little bit of tightening of the skin with liposuction, but that amount of tightening is pretty modest. If somebody has a fair amount of loose skin, or there's a concern that they can develop a fair amount of loose skin, then often somebody would want to use a tummy tuck instead. And the other thing is that liposuction doesn't tighten your muscles. Really, the only way to bring the muscles together and tighten that waist would be with a tummy tuck procedure. Of course, a tummy tuck is specific to the abdomen or the belly, whereas liposuction can be done elsewhere on your body. It can be done certainly on your abdomen, but it can be done under your chin and your neck area. It can be done on the chest. It can be done on the bra rolls or the flanks or the thighs, as being the most common areas. And then also very often we'll combine tummy tucks with liposuction. So we'll do both together to try to get a better contour for our patients. So another important thing is, when should somebody decide to go ahead and get a tummy tuck? So it's really important to remember that tummy tucks are not weight loss procedures. So I think sometimes folks are a little surprised with how much weight they don't lose with a tummy tuck. So if the goal is weight loss, the answer is not a tummy tuck. A tummy tuck is what you do after you've lost weight, after you're finished having children, and you're finished with going through pregnancy. That's when a tummy tuck should be done. It should be done when you're sort of at your goal weight, because it's at that point that you're going to have the most amount of loose skin. It's at that point where you sort of have the underlying frame that you want, and then we're using the tummy tuck to essentially tailor your skin to your smaller frame. And so that's really kind of the ideal time to pursue a tummy tuck. Now, tummy tucks are done under general anesthesia, so we want to make sure that you're healthy enough to do it. Most folks nowadays who have tummy tucks, we don't use drainage tubes very often at all. So most of the time there's no drainage tube. Also, most of the time folks are going home the same day. So most people do not need to spend time in the hospital. It's actually pretty rare if we're doing just a tummy tuck that we would ever admit anybody to the hospital. People go home the same day. Tummy tucks are a bit different than what's called a paniculectomy. So a tummy tuck is not covered by healthcare insurance. And the procedure that sometimes folks will sort of equate with a tummy tuck is called a paniculectomy. A paniculectomy refers to removing the overhanging bulge of extra skin between the pubic area and the belly button. But it's the overhanging tissue which is called the pannus. So the paniculectomy involves removing that. And the reason why insurance companies will sometimes cover that is because it allows patients, by removing that skin, to get better hygiene. They don't have to deal with the warm tissues that can develop underneath that area. So that's important. But a paniculectomy does not involve tightening the muscles. It's not a cosmetic procedure, so it doesn't involve trying to improve the contour of the abdominal skin and fat. And it also doesn't actually involve repositioning the belly button either. So those are some important distinctions between a tummy tuck, which is a cosmetic procedure, and a paniculectomy, which is an insurance-based procedure. Now, other important things, some new stuff with tummy tucks. So we kind of touched upon the fact that most folks don't spend the night in the hospital. It's actually rare that we would use a drain. We do now something called progressive tension stitches, where we essentially sew the skin and fat, or the apron of the abdomen, down onto the muscles. And what that does is it allows us, I think, to get a bit better contour, and it allows us to avoid the drainage tubes. And then another important thing these days is getting people back to work faster, feeling more comfortable faster after tummy tucks. And that's by doing things such as nerve blocks and doing what we call multimodal therapy, meaning that we, rather than giving patients a lot of narcotic medicine, we now give patients a little bit of anti-inflammatories, a little bit of muscle relaxants, anti-nauseants, and by giving small amounts of these other types of medicine, we're able to keep patients comfortable and avoid the need for any significant amount of narcotics. So people get less constipated, they don't get dependent on narcotic medicine, which is obviously an issue these days with the opioid epidemic, and so forth. So that's really, I think, a nice innovation. Also, in terms of scar management these days, we also have some newer technologies that can be used to try to reduce the widening of scars. So one product that we often use is something called Embrace, which is a series of adhesive tapes that can be used to offset the tension on a scar, so that as the stitches that the surgeon placed dissolve, this tape takes some of the stretch off of the scar, and that can help to reduce widening of the scar. So those are the main things. It's also important to know that the most serious complication of tummy tucks is actually a blood clot in the leg, most commonly. And so to try to avoid that, what we do is we do use an injection typically, or a blood thinner. The most common that we use is something called Lovenox. And essentially that's a medicine that's used to prevent blood clots. And so that's an important thing that we do for folks with tummy tucks. And certainly somebody's pursuing a tummy tuck, but they have a strong family history or a personal history of blood clots. That's something very important to disclose to your plastic surgeon, so they can formulate a management strategy to reduce your risk of that if you're choosing to undergo a tummy tuck. All right, and then the final thing is we very often combine tummy tucks with other cosmetic procedures. Very often a tummy tuck can be combined, for example, with breast implants or breast lift or both, or breast reductions. And certainly doing breast surgery with tummy tuck, particularly in women who have formerly had children, is known as a mummy makeover. And that's a very common procedure that we do for women in their 30s and 40s, most commonly, but certainly in other age groups as well. Other things that we combine with tummy tucks we kind of mentioned was liposuction as well, is very commonly combined, but it doesn't have to be limited to that. We'll do liposuction of the thighs. It can involve things like arm lifts or even face lifts, or other facial cosmetic procedures as well. So definitely tummy tucks can be combined with other procedures. Doing just sort of a straight up tummy tuck by itself in the operating room with a standard operation usually takes between about 90 minutes and 2 hours. Certainly more extensive versions of tummy tucks like body lifts, or with the addition of other surgical procedures, those operations can take longer as well. All right, and again, we certainly would urge you, if you're considering doing a tummy tuck, to do your research. We'd always advise you to see a board-certified plastic surgeon when making that decision. And again, you're going to want to think about things like your general health, your, if you're sort of at your ideal body weight going into this, what your goals are, making sure that you have realistic expectations of what the operation can offer, and that you're picking the correct operation to begin with. All right, so with that, I will leave you. Again, thank you so much for tuning in. I'm Dr. Myckatyn at West County Plastic Surgeons of Washington University. And if you're interested in any of this, we certainly hope to see you soon. And please tune in again as we explore other topics in cosmetic surgery and breast reconstruction on Facebook. Thanks very much. Have a great day.